Welcome back. Well, the SA Health Products Regulatory Authority turning down an application to use the Sputnik vaccine on an emergency basis in South Africa, it says it believes. Allowing the vaccine to be used here could put people who are HIV positive at a higher risk. Asiha Abdool Karim is a journalist at the Bhekisisa Centre for Health Journalism. She joins us now. Aisha, good afternoon to you. Please use small words. I find this very complicated. What is the link between this vaccine and HIV?
Yes, so just to correct your statement a little bit, the concern is not for people who are HIV positive when it comes to this vaccine. What SAHPRA is worried about is that for people who are HIV negative, so people who are not yet infected with HIV, the specific technology in the Sputnik vaccine makes them more susceptible. In other words, it puts them at higher risk of becoming HIV positive. So that's the concern with that. It's not for people who already have HIV, but it's for people who are at risk of getting HIV, and particularly for men. And the concern is that, so this particular vaccine, the Sputnik V vaccine, is a 2-dose vaccine, which means that you get 2 shots 3 weeks apart. And the difference between Sputnik V and some of the other 2-dose vaccines, like for instance the Pfizer vaccine, is you get 2 different types of shots. So with Pfizer, you get the same thing just twice in a row. Whereas with Sputnik, you get one vaccine that has a particular type of carrier virus inside of it, and then there's a different carrier inside the second shot that you come back for. And the concern is that the carrier virus, which is what's inserted into the vaccine, it's not actually going to infect you, like it's not going to make you sick or anything. But there have been two previous studies for HIV vaccines using this particular technology, and they unfortunately had to be stopped because the findings from those 2 HIV studies was that this particular carrier virus, which is called the adenovirus 5, can increase the susceptibility of men to acquiring HIV. So in other words, that people who received this vaccine in trials for HIV became more susceptible to getting infected after they had received the vaccine. And the issue with Sputnik and its current application to SAHPRA is it just hasn't provided enough data, or any data really, on how their vaccine performs in populations where there is a high, burden of HIV, or they don't have any testing that they've done on whether their vaccine is showing the same results as these HIV trials in terms of increasing your risk for getting infected later on down the line.
Okay, so I mean, this seems to be a pretty fundamental problem then. I mean, you can't tweak the Sputnik vaccine. It is what it is. This is always going to be a problem in our society.
Yes, so essentially the issue with the Sputnik V vaccine is that it's the only COVID vaccine that's currently being used that uses this particular type of technology. So for instance, the Johnson & Johnson vaccine, which we are using locally, and the AstraZeneca Oxford University vaccine, which was tested locally as well, both of those use the same type of virus, which is an adenovirus, and that's essentially, it's just a fancy way of saying a common cold, strain of a virus. But there are different subtypes within that virus, and so Johnson & Johnson and the AstraZeneca use the adenovirus 26. And that has also been tested in HIV vaccines. And there's a lot of safety data to show that, the technology that they're using doesn't carry this type of risk. Whereas with Sputnik V, because it's using this adenovirus 5 in the second shot that it's giving you, it does pose a challenge in that there is no, comparable data. There's no information that we have coming out because no other COVID vaccines have used it. And the existing vaccines that were tested for HIV using that technology have come out negatively. So unless the producers of Sputnik can test their vaccine in a country with a high prevalence of HIV, that it is safe, it doesn't look like they're going to be able to provide our regulator with, the data that it needs to say, yes, we can proceed with using this. And then the sort of alternative that the Gamaleya Institute, which is the Russian research unit that developed the Sputnik V vaccine, they have also developed another vaccine which is called Sputnik Light. And unlike the Sputnik V vaccine, Sputnik Light is only one dose. So there's no second shot, and it uses the same technology as the Johnson & Johnson. But South Africa has not yet received an application for this particular vaccine. And so for the moment, it does look like, any Russian Sputnik vaccines are off the cards for South Africa at the moment.
Asiha, Abdool, Karim from the Bhekisisa Center for Health Journalism. I really do appreciate the time and the explanation and the use of short words. Thanks very much.